Hi everyone, Dr. Connie here. So lately, as my kids are getting ready to go back to school, I have a son who's going off to high school, and over the weekend I've been busy training my yoga teachers to be yoga teachers, and as a result, I guess I've been under a lot of stress. And so lately, for the last 2 days, I've been developing a lot of IBS symptoms, irritable bowel syndrome. I occasionally get that when I'm stressed. So today, I'd like to talk to you about probiotics and the importance of that, because I get asked from you guys all the time about how long do I have to take it? Do I have to take it forever? What are some of the strains? And, blah, blah, blah. So there's a lot of questions around that. So I want to explain that we are a host to myriad of microorganisms, and it's on the skin. We've got about 1 trillion resident bacteria that live among us. In our mouth, we've got about 10 billion. And in our gut, there's 100 trillion. Approximately 2 to 5 pounds of the weight in our gut is made up of the bacteria. So, to put into perspective the relevance of bacteria in our body, when talking genetics, humans have approximately 20,000 genomes, and a common bacterial gene can have over 3.3 million, outnumbering human genes 150 to 1. That's amazing. And let me just be clear that when I refer to bacteria, the word is interchangeable with microbiome. So let's get to know our gut microbiota. Our colon is home to the highest populated ecosystems known to man. So it's reasonable to propose that the activities and the composition of our gut microbiome are directly responsible for human health and disease. Here's an overview of the importance of the microbiome in our gut. As you can see, a properly balanced and functioning microbiome can have an effect on a variety of things, including obesity, metabolism, detoxification, inflammation, and immune modulation. The composition of the microbiota can shape a healthy immune response or create disease, according to Nature Review's immunology literature that I reviewed. So what affects the health of our gut microflora? Age, diet, prebiotics, probiotics, antibiotic drugs, infant environment, maternal flora, mode of birth, C-section or vaginal, and genes and their receptors. So at birth, a number of factors affect the microbiome of infants. Preterm versus full term, mode of delivery, maternal diet and weight, hospital environment, contact with mother or hospital staff, or antibiotic use during pregnancy for the mom or in early days of life. Feeding choice is another thing that's really important, breastfed or formula. From those variables, our microbes increase in stability and diversity. So the factors that affect the development and acquisition of the infant gut microbiota for up to 24 months include breastfeeding versus formula feeding, antibiotic exposure, timing of weaning and foods chosen, home environment, and number of siblings and other living in the home. So in essence, early life exposure set the trajectory of gut microbiota and future health. So let's go to the topic that's the most important. So microbiome and aging. So the disturbance in the microbial balance can have a negative consequences for health, resulting in inflammation and infection that contribute to diabetes risk and cancer. And there's growing research that states that the microbial balance in the colon becomes increasingly compromised with age and triggers the onset of certain disease. So I hope I've made the point that while we're constantly bombarded by the toxins in our environment that threaten our gut health, we should be vigilant about keeping proper microbiome balance to support good bacteria in the gut. We're born 99% human, and we die 90% microbial. So the microbes we acquire at birth affect our health throughout our lives. It's no wonder we're seeing more and more effects of such imbalances later in life. So dysbiosis is not so much about the microbes as it is about the effects of those microbes on a susceptible host. It's about the relationship between the host and the microbe. Dysbiosis then does not result in classic infection. Dysbiosis in one patient may present with skin rash, and in another, same microbial imbalance in another patient can present as nerve pain or even joint pain or muscle pain. Often, with lupus or autoimmune patients, an inflammatory response to a non-harming microbe is what has caused the disease. Think on that a minute. So also, what we eat influences the population and the metabolic activity of our microflora. So the functions of microflora in the gut include metabolic activity, inflammation, and most important, protection, which provides a barrier from our invaders to our inside body. This is where the old adage, "we are what we eat," come from. Our diet determines which bacterial species and strains thrive in our gut, and they become essentially part of us. And no matter what your history is from infanthood until now, the good news is that diet can rapidly alter our microbiome. An elimination diet for a short time, as I shared with you in the past, along with the regimented probiotic and gut supportive supplements are so effective in improving your overall health. We are dynamic beings. Things change all the time. And this means that our microorganisms change depending on how and what we feed our bodies. And living as a lupus patient provides me with a new perspective on an impact that our lifestyle, such as our diet and activity level and stress, has on our overall health. I've seen both myself and my patients dramatically improve their health or state of health simply by cultivating awareness for their stress and mindfully choosing the foods that they consume and incorporating the movement into their daily rituals. These three things have changed the course of their disease and have allowed them to create health. So if you'd like more information of our complete alkaline detox program, where we walk you through step by step on how to transform your life from disease prone to health, visit this link. So thanks so much for joining me today, and please share, like, or comment below. You can find me also at lupusrebel.com or conniegion.com. And until next time, have a healthy day.